Okay.
So not just enough water, but also the timing of the water intake, it matters. Regular water intake throughout the body. Now many people ask me how much water should I drink?
Yeah.
Whether it is 4 liters, 5 liters, 3 liters.
Yeah.
So there is no one rule for every patient.
So much of information online. What's the worst advice you have heard people follow for kidney stones? Worst
Stop
advice.
calcium intake. All kidney stones, they dissolve.
Yeah.
But the fact is just less than 10% of the kidney stones they dissolve if they are too much soft. Okay, but more than 90% they don't dissolve with medications.
I had one stone, I got it removed, so I don't need to be worried about anything.
The risk of recurrence, as I already mentioned,
Yes.
it will be 50% in the
किडनी को आदत लग
lifetime.
गई है stones बनाने की. Drinking lemon juice or beer will dissolve stones.
Lemon juice, I will say, is beneficial, but beer not. It is a myth.
Tomato causes kidney stones, so they must be completely avoided.
This is a myth.
Biggest stone you have ever removed? What is the biggest size?
6 centimeter, more than 6 centimeter. It was 6.5 centimeter, that is 65 mm.
One food people fear but is actually safe in moderation.
Milk and milk products.
When should somebody take a single stone more seriously?
Yes, very important question, because I have seen a 8 mm stone lying in the ureter for months.
Today's episode is about kidney stones, a common health issue that's very simple to understand and even simpler to avoid with right habits. They are small mineral buildups that can cause discomfort, but the good news is they are usually preventable and manageable. We'll keep it simple. What causes them? What are the signs to watch out for? And how small changes in your routine can really help. Nothing heavy, just a straightforward conversation to keep your kidneys happy. Joining us today is Dr. Parag Gulhane, well-known neurologist and transplant specialist based in Pune. With over 14 plus years of experience, Dr. Gulhane has worked extensively across a range of urological conditions, from kidney stones and prostate issues to advanced minimally invasive procedures. He's trained in general surgery and urology and brings hand-on expertise in treatments like RIRS, PCNL, and much more. Let's dive deep into this conversation. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Parag Gulhane. Hello, sir. How are you?
As always, must. Feeling happy to do something different from our routine schedule.
I know, and I'm taking some time from you on your Sunday, precious Sunday. But then, yeah, this is important.
Yes.
So we are going to talk about kidney stones today, and while we will be discussing more on the treatment modalities and the aspects, and what should patient expect during a kidney stone treatment and the stuff. But we would also want to talk about what are kidney stones, right?
Yes.
So kidney stones, what we understand typically are the mineral deposits which happens in the kidneys, and there are so many things which goes around when it comes to kidney stone ki pani nahi piya so for sure short kidney stone hone wala hai, which I'm pretty sure that there are many other reasons to it. So also it is said that kidney stone ke jo pain hote hai, these are as bad as a childbirth pain. So we'll discuss all that, right? So tell us about kidney stones and what are these and how are they formed?
See, kidney stone disease, it is actually a very common disease.
Yes.
Estimates suggest that around 15 to 20% of the world population is affected by kidney stones.
Yes.
And it is equally found in both genders, that is males as well as females. Okay. Kidney stones, basically, they are deposits of the salts or the minerals inside within the kidney.
Achha.
Okay. Kidney is a excretory organ. It will excrete, and it is bound to excrete the minerals and the waste from the body.
It basically flushes out.
Yes. So, but when the concentration, that is the salt and the liquid concentration, it varies or it alters, that time these minerals, they deposit. And then layer by layer they go on depositing, and they result in the formation of a stone.
Achha. So these stones, as you said, that they don't have any gender bias. But they are very neutral. So are there any particular risk factors, which can predispose you to kidney stones?
Yes, there are hereditary issues. If kidney stone, it is well known that it runs in family.
Acha?
Okay, even obesity is one of the cause of kidney stones. Diabetes, hypertension,
Okay.
both are causes of kidney stones.
Mhm.
And apart from there are metabolic disorders of the kidney,
Mhm.
like increased excretion of oxalates, uric acid, what we in medical terms we call them as hyperoxaluria, hyper uric acid urea. Okay, so these are the various metabolic issues with the kidney which can result into kidney stone formation.
So as you said, oxalate, the
Yeah.
word, right? So what are the conditions and why this oxalate, excretion happens? I mean, what is the cause behind it? Is there any particular reason?
Yes. Now see, oxalates are routinely found in many of the dietary stuff, as well as some is prepared in the body itself also.
Acha.
The regulation it undergoes at two levels. One is at the intestine level and one is at the kidney level.
Acha.
So the dietary oxalate, if we have it, means it is bound to get absorbed in the intestines. Okay, and the kidney it excretes the oxalate. But along with it, if the calcium is present in the intestine, it will hamper, it will decrease the oxalate absorption in the body.
Acha.
But on the other hand, if the calcium is present in the urine, it will combine with oxalate and form the stone.
Acha. So, are there any particular, as you said, oxalate is a part of many dietary requirement of ours. So, are there any particular food that enhances the oxalate absorption in the body or something like that?
Oxalate is found in almost many type of foods. Okay, but I would talk only about those significant which has got significant. For example, spinach. Spinach has a high content of oxalate.
Yeah,
Okay, palak.
okay.
It is approximately a 1 cup of cooked spinach. It will contain approximately 750 milligram of oxalate. So it is considered as a high rich as compared to tomatoes. Tomatoes, around 100 gram of tomatoes contain just 5 milligram of oxalate.
Acha.
Okay, so apart from spinach, then there is coffee, nuts are there. Okay, beetroot is there, strawberries are there, chocolates are there. These are all high oxalate content foods.
Okay.
And naturally, if high oxalate food contents are taken along with calcium deficit diet or low calcium diet,
Okay.
then that oxalate will be more absorbed in the body.
So you are saying for dietary routine which is more rich in oxalate but deficient in calcium.
Yes.
Leads to this.
See, in simple words, calcium and oxalate have love for each other.
Okay, you cannot separate them.
We cannot separate them. No one can separate them.
Okay.
If they come together, they are bound to means they have a strong bond, and they together they form a stone or a molecule.
Achha.
Okay, so as I told you, if it is present, if they both are present simultaneously in the intestine, they will एक में को चिपक जाएंगे.
Achha.
And hence calcium will prevent absorption of oxalate into the body, into the system.
Achha.
Similarly, if oxalate is present along with calcium in the urine, they are bound to each other and they will form a stone over there inside the kidney.
Achha. So what would be the typical symptoms that patients can see? Because what I have seen even in my acquaintances is people who have kidney stones, they hardly get any symptoms initially, and it is usually diagnosed through a routine scan. So are there any symptoms that patients should look out for?
No, see, stone, it doesn't form एक दिन में नहीं बनता. Okay. It is a process, it is a slow process. Layer by layer it forms. The deposition of salts take place. Okay, so but why do people naturally they come to know when they have pain, or simply when do they have pain?
Achha.
So kidney stones, first they form in the corners of the kidney, which in medical terms we call as kidney calcium.
Achha.
So suppose the kidney has pockets within it. Okay, the stones are formed in the pockets. Okay. They are like a fruit which is stuck to the tree.
Achha.
Okay, on that the deposits of salts take place, and when they start, they are around 2 mm, 3 mm. Slowly they grow in size, 3 mm, 4 mm, 5 mm, 6 mm. At one point, that point we can't decide from outside when it will be. But at one point, this 4 mm or 7 mm or maybe 8 mm stone, it will detach, it will get separate from that callus, like a fruit falls down from a tree. Achha. Similarly, the stone, it will get separate from that callus, and as per the water flow direction, that is the urine flow direction, it will try to exit with the flow.
And that's where it gets blocked.
Yes, it blocks the tube, the mouth of the kidney, or the tube which carries urine from the kidney down to the bladder.
That's where it gets blocked.
Yes, when the blockage happens, it increases the pressure inside the kidney. Like
Yeah.
suppose we put a feet on a water pipe, the pressure will increase on the tap.
Yes.
So similarly, when the tube gets blocked, it will increase pressure on the kidney, and that increased pressure on the kidney will stretch the kidney and will cause pain. And hence, the stones which are present in the calyces, they won't cause any pain. People are not aware of them until unless they are diagnosed in the calyces. They are silently sitting over there. But when it will cause blockage, maybe at the mouth of the kidney or in the ureter, they will have severe pain.
Severe pain. So as you said that, there are multiple other reasons apart from not drinking water for kidney stone formation, and few of these are chronic conditions like, diabetes, blood pressure, hypertension, and all that stuff. So now coming to the diagnosis part of it, as we already discussed that, kidney stones usually don't come up with the symptoms in initial phases, and are often diagnosed through a routine checkup. So is there any routine checkup which you recommend for normal people, people with hereditary history or family history of kidney stones, and people with chronic conditions? What would be a diagnostic test or preventive measure that you would recommend for such patients?
Yes. Now, diagnostic test best is considering the safety profile. Best is a ultrasound.
Acha.
Okay, because as we all know, sonography is completely safe and it is a cheaper option available.
Yes.
Okay. Ideally, test for a kidney stone is a CT scan. Okay,
Acha.
for a symptomatic patient, we should always do a CT scan. But for screening purpose, sonography is fine.
So, annually once.
Yes,
getting a
for those who don't have any family history or don't have any previous history of kidney stones, they can get it done annually once. For those who have got a family history of kidney stones or some other risk factors like anatomic abnormalities in the kidney or any other metabolic disorders, so they must do it at least six monthly, half a year. Yes, and those who have had previous history of multiple stone formation, they should at least do it every 3 months.
Okay, so as you were saying that diabetes is also a reason. Can you help us understand a bit, because considering that India is the diabetic capital of the world, going sooner to be one. So, what is the correlation between diabetes and an increased chances of having a kidney stone here?
So, diabetes, there is increased amount of sugar excretion in the through the kidneys.
Correct.
Okay, and sugar, it is a promoter. There are something called as promoters and inhibitors of stone formation. Like promoters mein aata hai oxalate, citrate. Okay, sorry, not citrate. It is oxalate. It is cysteine. Then similarly, sugar, salts.
Acha.
Okay, these are the promoters. And similarly, in inhibitors, we have citrate, magnesium, potassium. These are the inhibitors. So sugar is one of the promoter of stone formation, and hence diabetic patients, they do have an increased risk
of developing kidney stones. So when we talk about the symptoms, right? There are certain patients who pass on certain level of stones through the normal urine.
Yes.
It is very much understood, as you said, that there are no particular factors which might lead to the release of that stone from that interior section of the kidney and pass through the urine. But why is it so different? I mean, for some patients, they pass on the stones through the urine and some don't. So what is the mystery behind this?
Mystery behind is simple words. We are not a machine. Every body is different.
True.
So internally also, what even we feel it when we operate, we operate so many patients, thousands of patients in a year. And hence we come to know that inside also our ureters are different. Not every ureter is similar. Some ureters are good dilated and some ureters are very tight. They don't even allow an endoscope to pass inside.
Yes.
Okay. So that is the reason why few people don't pass even 4 mm stone and few can pass even 10 mm stone. So we naturally go by proportionates. Okay. Now, if a stone is very smooth, it is like ekdam smooth margin stone, it will slip out early. Okay. But similarly, if a stone has got a rough margin, it will scratch the tube, it will cause edema over there and it will not pass.
Okay.
So not just size, it is the shape of the stone which matters. It is the surface of the stone that matters. Even it is the hardness of the stone that matters.
So size probably is one of the fourth or fifth factor we can say here, because there are a lot of other
we can
things.
say it is the main factor, but there are other associated factors also.
Okay.
But size is the main factor and on which we decide the treatment. But as I told you, we have to categorize the patient. It is not a fixed by rule for each and every patient.
So is this true that once you form kidney stones and it can reoccur again?
Yes, worldwide studies have proven that
Acha.
that there is a 50% risk of recurrence if a person had a kidney stone previously.
Okay, and that again contributes to the oxalate deposition and the dietary things and
Yes.
the risk factors.
In simple words, you can say that the kidney develops the tendency to form the stone.
Acha. Okay. So now coming to the treatment part of it, we have heard about lithotripsy and then the shockwave surgeries. So help us. What are the treatment modalities? And before I go to the surgery part, does all kidney stone requires a surgery, or can there be medical management also?
Not all kidney stones need surgery. As I told you, a non-obstructed stone, particularly if it is less than 6 mm of size, so it can be managed, or we can try for medical therapy since it's not an emergency. We can give it a chance with the medications. Okay, so we have to decide on whether the surgery is needed or not based on other factors. How symptomatic the patient is, how big is the stone, how old are the symptoms, and what are the other comorbidities for the patient.
Okay, and what would be the different treatment surgical options, and how do you decide which surgery to go for?
Yeah, the treatment options available now and those which were available around 30 to 40 years before have drastically changed.
Yeah.
Okay, previously all the stones in early days were managed through open surgery.
Yeah, now we have
but now
laparoscopy
almost we don't do any open surgery nowadays for kidney stones.
Okay.
Even laparoscopy has significantly decreased.
Acha.
Most of the stones which were previously managed by laparoscopy, like a big 20 mm stone in the ureter, it was previously done by laparoscopic opening the ureter and removing it whole. Okay, but now RRS is available. Retrograde endoscopes are so very much efficient. The lasers are very much efficient that we are able to do even those 20 mm stones endoscopically without the need of even a laparoscope.
So what is this shockwave lithotripsy? I mean, how does it work?
Yes, shockwave lithotripsy, it is basically not an electric shock.
Yeah, that's where I was coming, because the word shockwave lithotripsy kind of brings a lot of apprehension. So help us understand and our viewers that shockwave lithotripsy is not a shock.
It is not a shock. Those are actually sound waves. Those are high frequency sound waves which from a machine, from a generator, are focused, are targeted on the stone.
Achha.
And those sound waves, they hit the stone and they break it
basically. Yeah. So apart from these other the traditional way and the shockwave lithotripsy, what does the future of kidney stone removal looks like? I mean, what are the advancements are we expecting in the future?
Now even shockwaves have we seldom do them. Okay, because it has got its own limitations. Like hard stones won't be breakable with shockwaves. For example, if you are reading a CT report, if the hardness of the stone is more than 100 HU, it is actually Hounsfield unit, but for patient understanding I usually call it as a hardness unit. So if it is more than 1000, it is a hard stone.
Achha.
So that has got a poor success with shockwaves. Similarly, the stones which are located in the lower pole of the kidney, means the dependent portion of the kidney, they, even if we break them, the fragments won't jump out from there and come out. Okay, so naturally the fragments are bound to stay there. Okay. Another thing, we have no control that how small we can break the stone with the help of a sound waves or the ESWL.
Yeah.
Okay, there might be big fragments also, or there might be small fragments also. Okay. So it has got many limitations like obesity, increased fat around the kidney. It also limits the efficacy of the shockwave therapy. So it is slowly we are decreasing. I though rarely have seen or advise people for shockwaves. Now we have got much better and advanced options available. That is a RRS or a laser URS. Okay. In this thing, we go endoscopically from where the urine comes out. We enter inside and we can reach to every corner, almost every corner of the kidney inside. And under vision, we can literally dust all the stone. And plus, now there are suction facilities also available. We can suck all the dust and the fragments.
Okay.
So we are able to achieve almost 100% clearance
Wow.
as compared to what was 70 to 75% with a shockwave therapy.
With the shockwave therapy. So now, does this treatment option and the modalities changes when a patient has a UTI?
Definitely. Ideally, I always do a urine culture sensitivity before posting a patient for a RIRS. Why it helps? It has got two importance. First of all, if the infection level is almost significant, then we have an opportunity to guide the appropriate antibiotic therapy before posting him for a surgery. And even if the patient is in pain, I have to operate him in emergency. Urine culture report will take around 2 to 3 days for the come. But even in post-op period, it will help me to guide whether there is infection, which organism is there, and which antibiotics to be given to that patient. So post-op treatment would be much better
and
if
uneventful.
We have,
if you have a good urine
if we have a good urine culture and we have a good control of infection. But if the patient is grossly infected, for example, what I mean with grossly infected is that if his kidneys are filled with pus, if he's having clinical symptoms like fever, or any other symptoms like severe infection, like drop in the BP, blood pressure, or increase in the pulse rate, then in such patients, we usually don't waste time on breaking the stone. We first give only drainage to that kidney. That is done by means of a small tube, which is called as a DJ stent or a double J stent, we call it. So that is inserted, that bypasses the stone. It goes past besides the stone, and it will help to drain out all the stagnant infection from the kidney. And we give some time, that is around 3 weeks time, for the kidney to recover, and then it is safe inside and go and break the stone later or after. Of course, there will be a one stage added, but that will be a better and a safe option for the patient.
And I also think that it will also add up to a lot of post-operative infections or issues. You can control them better, much better. So when it comes to the causes of kidney stones and some other myths about kidney stones, I have certain questions with me right now, which I'm holding here, and I'm going to ask you. So these are a mix of most frequently asked questions, which I'm pretty sure many of your patients have asked you. So we'll go one by one and let's see what our doctor has to say about it. So the first thing which cannot be ignored is dehydration, and not drinking water is the only cause for kidney stone.
It is not the only cause, but it is a significant cause. You should always drink not only just sufficient amount of water, but also the timing matters. I've seen people, they tell, मैं सुबह उठ के तो बहुत पानी पीता हूँ, but later in the day or in the evening or the night time, if you decrease your water intake, so that time the urine will form concentrated. Correct. And that will result into deposition of salts. So not just enough water, but also the timing of the water intake, it matters. It should be regular water intake throughout the body. Now many people ask me, how much water should I drink? Whether it is 4 liters, 5 liters, 3 liters. So there is no one rule for every patient. It depends how much your body needs water. So how to judge that? You should be able to pass at least more than 2 liters of urine every day, and the urine should be light tinge yellowish in color. So it should not be a concentrated urine, and the output should be at least more than 2 liters.
So moving on to the next question, which is I think drinking less amount of water causes kidney stones, or you are more prone to having kidney stone. It's no longer a secret anymore, but there we do have some patients who have fluid restriction. So what are your advices for such patients, and how do they keep themselves safe from kidney stones while they cannot have much water intake?
Yes, there are few subset of patients like those who have got CKD, that is chronic kidney disease, or old patients having prostate problem. We do advise them limit the water intake, okay, but then they can if they are simultaneously having or suffering from a kidney stone disease, we can start medical therapy for them instead of water. Okay, so that option the patient should explore.
Okay, so also during the treatment of kidney stones, A word which is, which scares many of us is the word stent.
Yes.
So also because stent is, very commonly used in many other modalities of
Yes.
healthcare, I think stent is something which brings a lot of apprehension. Break it down for us.
Yes. So DJ stent, that is a double J stent, it is actually for the benefit of the patient.
Acha.
How it helps? It helps the kidney to recover.
Acha.
It helps to drain out the infection out.
Acha.
Plus, if the stone it is stuck in the ureter and it has caused edema on the ureter, if we don't put a stent, there will be a risk that while the phase of healing, the ureter might go down
Shrink.
narrow, or it will form a stricture over there.
Okay.
So there this risk would be there. Apart from that, stent also helps the small fragments and the dust which we create to pass out. So in short, I'll simplify it. If your leg is operated, a doctor will give you a walker for 15 to 20 days.
That's for
So
your support.
just it is a support. The stent is a support. It is a walker for your kidney till your kidney recovers from this insult.
So there's nothing to be worried about.
Nothing to be worried. Of course, it is somewhat discomfort is there, but people should accept it as it is beneficial for them.
Yeah. So moving on to the next segment of this podcast, which is I ask you a quick questions. These questions can be, most frequently asked questions by your patients, which I'm very sure you're tired of hearing already. Some myths and facts. So let's dive into that section. Okay. So with so much of information online, what's the worst advice you have heard people follow for kidney stones? Worst
Stop
advice.
calcium intake.
Oh my god. So,
this is a myth. People they literally stop everything calcium rich. See, calcium is an essential mineral for your body.
Yes.
It is important for heart, for muscles. So calcium is required at least 1 gram per day. So don't stop calcium intake. In fact, low calcium will also cause stone formation. So it should be regulated calcium intake. You should take milk and milk products, okay, since it has calcium in it.
Do not cut down completely.
But it should not be in excessive form, like supplements in the form of tablets.
One thing people always believe about kidney stone that isn't true.
All kidney stones, they dissolve.
Yeah.
But the fact is, just less than 10% of the kidney stones they dissolve if they are too much soft. Okay, but more than 90% they don't dissolve with medications. Okay.
Only people who don't drink enough water get stones. I think I know the answer, but I'll still ask you to repeat it.
As water intake is not the only one factor, there are many other factors also. So we just can't determine based on the water intake alone.
I had one stone, I got it removed, so I don't need to be worried about anything.
The risk of recurrence, as I already mentioned, it will be 50% in the lifetime. So you should be careful, you should be vigilant and do regular checkups.
Avoid calcium and that will stop kidney stone formation. I think you have already answered that. Okay, now comes the dietary related questions. Coconut water, barley water or XYZ home drink will melt stones. Myth or fact?
It is partially true, because it won't melt, but it will at least form, it will at least help in the decrease in the size of the stone, or help it to prevent grow in size. How? Because these fluids, they are usually alkalizers, and also they contain some amount of citrate and potassium in it. As I told you, these are the inhibitors for stone formation. So naturally a 3 mm stone, you can prevent it from growing with the help of these fluids.
Okay. Avoid all oxalate rich foods like spinach and nuts if you have stones.
Oxalate rich foods which have got high content of oxalate, you should avoid them. As I already mentioned,
so
spinach,
complete
nuts
complete avoid, you are saying?
Occasionally, rarely you can take them, but those which are less in oxalate intake, which have got small amount, those don't matter.
Okay. Drinking lemon juice or beer will dissolve stones.
Lemon juice, I will say, is beneficial, but beer not. It is a myth.
Yeah, beer, I have heard it from many people that beer has that fizz, so it crushes the stones.
No. In fact, see, beer is a diuretic. It will result into increase in the urine formation, so it will help to flush out the stone. But apart from that, it doesn't have any advantage. But as you compared with water also will cause diuresis and it will increase the urine formation.
And will not have any other side effect on the body.
So beer is not a healthy way to prevent a kidney stone.
Tomato causes kidney stones, so they must be completely avoided.
This is a myth. because as I told you, 100 gram of tomato just contains only 5 milligram of oxalate. So tomato is comparatively much safer if you moderate the intake.
Okay. Biggest stone you have ever removed? What is the biggest size?
6 centimeter, more than 6 centimeter. It was 6.5 centimeter, that is 65 mm.
Oh my God. And the patient was landed up in ER, or how was it?
No, actually, see, such stones, they are it is not a day formation.
Yeah, of course.
They have taken it years to form that much of stone.
Yes.
So of course they have ignored some silent signs like backache, mild discomfort in the kidney. Okay, even few people ignore urinary. I have seen a bladder stone. I have removed a bladder stone more than 6 centimeter. Approximately it was 6.5 centimeters.
Achha.
Naturally, the patient complained to me that he had bloody urine sometimes. There is discomfort or there is burning while passing urine, but he was bearing it since years and trying alternative therapies, but then finally he had to
do what had to be done. Okay, one food people fear but is actually safe in moderation.
Milk and milk products.
Okay. Harder to treat, calcium oxalate or uric acid stones?
Calcium oxalate. They are the most hardest type of stones, especially the calcium oxalate monohydrate content.
Achha. So before I finish this section, my last question to you would be, when should somebody take a single stone more seriously?
Yes, very important question, because I have seen a 8 mm stone lying in the ureter for months.
Achha.
And people ignoring, trying alternative therapies for that to remove. But always remember, if a stone, maybe it is a 4 mm, 8 mm, 6 mm in the ureter, stuck at the same place, it shouldn't be at the same place.
Achha.
It is more harmful. It will damage your tube also, and it will damage the kidney also. So the stone should be moving. It should be descending down. So this is a warning sign that a stone remaining at the same location for more than 2 to 3 weeks, immediately go and remove it.
Definitely. I think we have covered almost everything that was related to kidney stones in this episode of our podcast. But before I let you go, share some case with us which you have done, and which has a clear memory from the past.
Yes, there are many such cases, but yes, would like to share one. Okay, a old patient, old person actually, he had a retention of urine. He was not able to pass urine, and he was on catheter, on a tube since almost 4 to 5 months. He visited 2 urologists also. All the investigations, the tests were done, and he was found to have a prostate enlargement, some prostate enlargement, and a weak bladder, almost a contractile bladder. That is, the bladder is completely gone. Okay, so he was told that surgery won't benefit him, and he will need self-catheterization or a permanent catheter in situ. He was roaming here and there since 3 months. He came to me. Even at first instance, I counseled him that there might be this thing that even after surgery you won't be able to pass the urine, and even after surgery you might need a catheter. She said, sir, we will take a chance. And I operated him, and believe me, that person is so happy now. He can so well pass his urine. He doesn't need a catheter, and he was so grateful and so thankful to me.
You gave him back his freedom.
Yes. The crux here is that we cannot go by the books always.
Yeah, that's where I think the experience counts.
Yes.
So it was wonderful having you on the podcast today, and thank you for giving us this time and sharing so much of information. Anything last that you want to tell to all our viewers about kidney stone? Any last message if you want to share?
Don't ignore, take it seriously, and take an expert advice. That is much more important.
Yeah. On that note, signing off, Dr. Tushita, Sahyadri Health Talks. Thank you, doctor.
Thank you. My pleasure.